One of the most pressing challenges we face as a society is in relation to our health, specifically healthcare. So the question comes, what role can faith-based healthcare play in creating spaces that provide healing to individuals and community? Suzanne Watts Henderson from Interfaith America recently sat down with AdventHealth CEO Terry Shaw to take a closer look at how we live out our mission that stems from our faith as one of the largest religious healthcare organizations in the United States.
So Terry, thank you so much for welcoming me to AdventHealth. Thank you for the time that you've taken, and most especially thank you for your witness to really important work at the intersection of faith and health.
Glad to have you here. Thank you.
I love how you claim your deep ties in the Seventh Day Adventist tradition, and yet we both know that we live in a very diverse world, and increasingly so, religiously and in so many other ways. Will you share a little bit about how that Seventh Day Adventist legacy and rootedness really helps you encounter patients and also staff and others who have different religious identities?
Absolutely. We believe that every person's a child of God. And when you show up, regardless of whether you're of a faith tradition or no faith tradition, we still view you as a child of God. And so from our perspective, we take care of who comes in, we hire who comes in, and our job is to have an intersection of faith and healing so that we're caring for you as a whole person and that we're helping you on a journey with your health, regardless of your religious background, your gender, your ethnicity. It doesn't matter to us. Our job, as we see it, is to treat you the way Christ would treat you in the New Testament.
I grew up in a Christian home. I was really privileged to have parents who are very faithful, grandparents and aunts and uncles who are faithful. I grew up in the Protestant faith, growing up in different denominations. And I really grew into my faith and discovered that what it meant to me personally as an adult, as I feel like God sometimes does, gives us some challenging seasons, and really came into that in my own. I spent about a dozen years working in the news industry, and after transitioning out of news as being a journalist, I was looking for a career where I could continue to leverage those skills and my passions for communications, but I wanted to work for a nonprofit. And there was an opportunity to join the communications team at what was then Florida Hospital, today AdventHealth. And when I joined the organization, it was night and day. I had never worked in a organization where you could openly pray. I'd never worked in a culture where leaders stopped and asked, could they pray for you? Did you want someone to pray for you? There are certainly visible signs of the organization's faith-based roots. You can walk through our hospitals, you can see artwork and sculptures, but then there's also just the signs in the people. There's a palpable presence of joy and hope that permeates a lot of team members and leaders here, and it's evident that they find a source of joy that is from a higher power.
Our mission of extending the healing ministry of Christ here at AdventHealth, it extends beyond just the Seventh Day Adventist background, right? So we've got team members. We're 80,000 team members strong, and we're not all the same, right? And so we have multiple opportunities where we come together. And a specific example of that is our Asian American Pacific Islander Heritage Month. In this instance, we had 5 or so participants talk about what their culture means, how they celebrate, maybe some of the differences and similarities between that, and how they show up to work every day, even though their backgrounds are different and their religious backgrounds are different.
Faith is very important, right, for all of us. And so in the Indian religion also, many people think we're polytheistic because they see different gods, right? But there's actually one God, there's one deity, and they're reincarnations of that one deity in different forms. And so teaching the kids about the importance of why or who or what in this religion, and we work in a Seventh Day Adventist organization too, and being able to appreciate Christianity and And Buddhism or what have you is also supremely important because it teaches our next generation how to appreciate other cultures while absorbing and passing on their own. So I think that's the beauty of America, is the ability to do that, actually.
What I'm hearing is that there's so many similarities in just the way that we value these different characteristics of our cultures. It's very comforting. We're created more similarly than we are different, it seems.
Very true. Yeah. And I think there's a lot of unconscious biases that are out there that, you can always kind of profile and say all Indians are Hindus,
like this, yeah.
or all Indians. There's so many different religions in India, and I think it's important for us to always have that in the back of our mind and stirring up that conversation with people that just don't know.
We're more similar than we are different, and you can come to work under the same mission of extending the healing ministry of Christ, despite having a different background maybe at home. And so it's a beautiful synchrony of people coming together and celebrating that and doing the work every single day.
During COVID, I think this concept of how we're all part of the human race, all wanting to be compassionate towards one another, really we saw expressed in ways that maybe we hadn't in the past. The Sikh community, which is a very active community in the Seminole County where I was, were very interested in the well-being of the hospital and the providers. And so they had many times organized and brought food to the entire team. The Muslim community, actually one of the employees who work at the hospital approached me and said, would it be okay, they wanted to be sensitive to our religion, would it be okay if our mosque came and did a prayer over the hospital during this time of great crisis? And of course we were thrilled. And it was an amazing experience, as the entire parking lot, which didn't have a lot of external cars in it, was filled up with the members of the Muslim mosque, honking their horns, flashing lights. They had prepared signs. And the imam actually said a prayer, 2 prayers in fact, and gathered their congregates of the mosque to share that with the hospital. Our employees were looking out the windows down onto the parking lot and seeing this faith community, the Muslim faith community, honoring the work that they did. It was beautiful. And we also had Christian communities do the same thing. We had a prayer service in the parking lot from one of the local Christian churches that did a similar kind of thing. But during that moment, of crisis, everyone realized that what was most important was us pulling together. And the elements of our faith that bonded us, looking at with compassion people who are broken and hurting, realizing that real people were expending their energy taking care of those people, and they needed to be well cared for as well. That just meant so much in terms of an expression. It really was healing ministry.
Speaking out of your own religious tradition, but also as a healthcare system, how do you view healing and wholeness?
Every person's created in the image of God, and you are not a pneumonia or a breast cancer or a broken leg. You are an individual with some type of illness that needs to be solved, but you're a whole human being too. You have thoughts, feelings, beliefs, experiences that are different than anybody else on the planet. Well, our mission is to extend the healing ministry of Christ, and it is now in a daily expression in modern day society, from the large hospitals we have to the hundreds of outpatient sites that we have that are all connected to provide care. Our values are very faith-based, and our service standards are very simple. We want you to be safe. We want you to be loved. We want to help you with your journey, and we want to do our best to make it simple. As a matter of fact, it's amazing to me the number of people that walk in the door that have never said a prayer or had a prayer said for them.
I got sick, and I wasn't feeling well for a couple of weeks. Noticed I wasn't getting any better. I couldn't breathe. I was short of breath and just weak. I almost couldn't stand up. And I was admitted and diagnosed with COVID and double pneumonia. After I was moved out of ICU, I was taken to a regular room to recover. One of the first memories that I have was a nurse that came in. She was another person that was very crucial in my healing. She came into the room and greeted me and introduced herself. And one of the first things she said was, "Can I pray with you?" And that was just this wave, this warmth came over me. I said, "Yes, please, I would love that." She held out her hands and held my hands, which was another thing, just having someone touch you when people are afraid to come near you or come into your room. She prayed with me. Sometimes she would tell me she loved me, and she would help me with little things. That was so sweet of her to do. I don't even know if I would have made it without the personal care and touch that I received from her, and also the lady in ICU. When I prayed to God and asked Him to help me, I believe that He worked through those two ladies to show His love to me.
I've learned a little bit today about the intake questions that engage perhaps not specifically religious identity, but questions that swirl around meaning and sources of life. Say a little bit about those protocols and what they bring to your system and to your patient and provider experience.
When people walk in the door today, they get screened for 3 questions. Do you have somebody at home that loves you? Do you have a source of joy in your life? Do you have a sense of peace today? The answers to those 3 questions branch you off into other things other than physical issues. People are not just a sum of their diagnoses. They're a sum of their thoughts, feelings, beliefs, and experiences. And you have to get to the root of what's going on in a person's life if you're going to really help them with a healthcare journey.
Clinical mission integration is really a big way of saying spiritual care in our outpatient environment. You know, we're historically a hospital system, and for years we put a lot of energy into ministering to whole person care in a hospital, chaplains and other training for our staff for that spiritual component of people when they're dealing with illness. But as we've realized over the last 10 years, more and more people are actually getting their care not in a hospital, but in an outpatient clinic. And yet we hadn't really built an infrastructure to support those areas. So in the last 5 years, this concept of how do we bring care and spiritual sensitivity to the outpatient setting has become a growing momentum for us. And so that's why we call it clinical mission integration, because it's outpatient clinical settings. But it's really designed to do a couple things. Number one, it's designed to support our physicians. Our physicians who give so much of themselves, their own well-being needs to be taken into account. And in 2 ways: one, helping them connect more meaningfully with their patients by asking questions and interacting with them beyond just how does your pain feel, became an important part of creating that conversation, as well as visiting and nurturing them, praying for them. Their own staffs in the same manner need that kind of support. So our teams now visit the outpatient independent practices, their employed practices, our ambulatory care, rehab, and imaging centers, and they minister to the staff and to the providers there so that those cups can be filled up a little bit, so they have that much more to share in a way that really expresses the healing ministry of Christ to the patients who come through those doors.
We want to thank Suzanne and Interfaith America for visiting AdventHealth to understand how we live at the intersection of faith and healing. We think it's true. Faith-based organizations can play a unique role as expressions of ministry, creating a space where people, regardless of their religious affiliation, can come together to make each environment a better place. The mission that motivates us is extending the healing ministry of Christ. But what we want more than anything is for our patients and our communities to feel whole.